It might sound like a good idea. Take one pill, it combines both vitamin D3 and K2. After all, they're supposed to work together to move calcium out of your arteries and into your bones, right? But here's the problem. Most combination supplements get the balance all wrong. When this happens, these two vitamins can actually cause more harm than good. In this video, we're going to look at D3 and K2 and what they really do, how they work in the body, and why putting them together in one pill might not be the best idea. At least it hasn't been so far. At the end, you'll learn one of the best ways to get more K2 from food and whether or not you need to take a pill to supplement. Let me tell you about someone I worked with. Let's call him Arnold. Arnold is 52. He's active, he eats well, and he started looking into supplements to take better care of his heart and his bones. Like a lot of people, he came across vitamin D3 K2 in the same pill. He read that they worked together, saw the combo pill online, and added it to his routine without thinking much about it. But after a few months, things didn't go the way he expected. We'll come back to Arnold in just a minute, but first, let's look at what D3 and K2 actually do in the body. I'm sure you've heard about the benefits of D3, like strengthening bones and the immune system, even mental health and diabetes. But one of the most important jobs of D3 is to help your body absorb calcium. Calcium keeps your bones and teeth strong, but it also helps your muscles, your heart, and nerves work the right way. Without enough D3, your body has trouble using calcium and absorbing it, so bones become weaker. People with low D3 levels often have more problems with heart disease over time. So it's important. Now let's talk about K2 for a minute. K2 is another nutrient. It helps with calcium. It moves calcium into the right places like your bones and teeth. K2 comes in different forms. The most common ones are like MK4, MK7. It's short for menaquinone, and there are multiple versions. MK4 and MK7 are the most common ones that you'll hear about. These MK4, MK7, and the others differ in a few things, like how long the vitamin stays in your body and actually how it works. MK4 doesn't stay in your body very long. It works quickly, though. Osteoporosis and osteopenia, not enough calcium in your bone. So it helps with that. It's been studied for it, and it helps move calcium into the bones with the support of D3. It also shows some promise on reducing plaque buildup in the arteries, believe it or not. MK7 stays in your body much longer, all day, and it builds up over the time. That makes it useful for keeping steady levels of K2 in your blood. It's the form most often found in supplements, but you are seeing more these days with MK4. How does K2 actually work? Your body has a special protein called matrix GLA protein, or let's just call it MGP for short. We don't need to remember those longer names. MGP's job is to keep calcium out of places where it doesn't belong, like your arteries, your heart valves, and kidneys. You can think of MGP like a traffic cop for calcium. It helps stop calcium from sticking to the walls of your blood vessels. But MGP can't do its job unless it's switched on. That's where vitamin K2 comes in. Vitamin K2 activates MGP, which means it changes the protein's shape so it can start working. Without enough K2, MGP stays inactive. That's that matrix GLA protein. So it's there, but it doesn't block the calcium properly. So when MGP is inactive, calcium builds up in places where it shouldn't. And even worse, it doesn't make it to your bones and teeth where it's needed. But K2 doesn't just help with bones and arteries. It also helps your body handle blood sugar better. This is a key item, and let me repeat it. K2 doesn't just help with bones and arteries. It also helps your body handle blood sugar better. Now, one of the ways it does this is by helping your body make more of a hormone called GLP-1. You ever hear of that one? GLP-1s. That's like the hormone that Ozempic and some of these weight loss drugs was made from. Your body makes that hormone internally. So you want this enzyme, GLP-1, to work effectively. You get better blood sugar control You feel less hungry. Your weight stays down in a healthy place. But K2 doesn't tell your body to make GLP-1 directly. It works through a chain reaction. Here's how it works. When you take vitamin K2, it changes the good bacteria in your gut. Those bacteria then make more bile acids and short-chain fatty acids. Now, what have those got to do? They're natural substances that your body uses to digest food and send signals as well. Those bile acids turn on special receptors in your gut. Once those receptors are active, they tell your body, make more GLP-1, that natural internal hormone that your body uses to prevent diabetes, to prevent metabolic disease, to keep your weight where it should be in a healthy state. So it goes like this. Vitamin K2 goes to better gut bacteria. Better gut bacteria creates more bile acids. More bile acids turn on those receptors. And when those receptors are turned on, you've got more healthy internal GLP-1 enzyme being made by your body. Now, that's how vitamin K2 helps your body manage blood sugar. It's a long process, but a helpful one. Now, there's something important to clear up here. You'll hear this online a lot. Vitamin K2 pulls calcium out of the arteries and puts it into your bones. That might sound good, and it sounds logical to a lot of people, and in theory, they may want to say it's true, but it's really more logic than truth. The bigger benefit of K2 is how it helps reduce insulin resistance. If you've followed this channel for a while, you know how important it is to manage and reduce insulin resistance. So my perspective on vitamin K2 is that, yes, for some people it's most helpful with calcium management, but that's really only some people. For the vast majority of people, vitamin K2 is most helpful by helping you with undiagnosed metabolic disease, insulin resistance, prediabetes, diabetes, again, metabolic disease, an inability to manage glucose, your big fuels. Because that's the biggest driver of arterial plaque buildup. It's the biggest driver of heart attack, stroke, eye disease, blindness, kidney disease, kidney failure, even erectile dysfunction for men, and cognitive decline, Alzheimer's. So, here's something worth knowing. For someone who already has improved their lifestyle, calcium in the coronary arteries can actually be a sign of plaque stabilization. That means there's less risk of a heart attack, not more. So, as you can see, vitamin D3 and K2 work together to help prevent both osteoporosis and heart disease. This teamwork is why many people think it's a great idea to take them together. But there's something important most people don't know. Most combination pills give you 5,000 units, international units, for D3, but only about 90 micrograms of K2. The bottom line is that ratio is backwards. It might sound like enough for K2, but it's not. We don't take K2 just to follow along or supplement D3. We take K2 because it has its own important benefits. As we said, the benefits associated with calcium are just the sideshow. The biggest benefits for K2 have to do with metabolic disease. So don't let someone's incorrect proportions in the supplement that they create, the combo pill, dictate for you how much K2 you take. That is an error. Like we mentioned earlier, K2 helps prevent osteoporosis and supports that. But the bigger thing is it improves artery health by improving insulin sensitivity. To get those benefits for vitamin K2 or from vitamin K2, most people need at least 400 micrograms of K2 per day, not 90 or 100. On top of that, D3 shouldn't really be taken in a fixed amount anyway. The right D3 dose depends on your blood levels, not the label on a bottle. So again, you're letting someone else determine what your health is, and that's not a good thing. You need to know enough to be able to manage it yourself. I'm sorry, but you do. Most people are healthiest at D3 levels between 50 and 90 nanograms per milliliter. And you can only know that by doing a lab test. Again, it gets to that old saying, test, don't guess. And that's a big deal in managing vitamin D3. So when D3 and K2 are stuck together in one pill, you lose control, really over both. You can't take more K2 without taking too much D3, and that can be dangerous. And you can't lower your D3 dose without going to nothing on your K2, even if your body needs more of it. So here's something else important to understand. You don't really have to worry about taking too much vitamin K2. Research has shown that safe doses for bone health can go as high as 45 milligrams per day. It's just so much more than the typical dose in supplements. It's a different story with vitamin D3. When you take too much D3, your body can absorb too much calcium from food. This can lead to a condition called hypercalcemia, which means that there's too much calcium in your blood. Now, that may not sound bad, but it is, especially if you're over age 50. Be very careful about the calcium levels in your blood. Calcium is only helpful when it's in the right place. Too much in the blood can cause real problems. The extra calcium can form hard crystals that turn into kidney stones, which are painful and make it harder for your kidneys to work. Too much calcium in the blood can also reduce blood flow to the kidneys and injure them. They don't get enough oxygen, and they can't filter the waste the way they should. Your kidney function begins to erode, and there are people that have been known to even die from really high levels of vitamin D3. So even though D3 is very important, taking too much for too long can stress your kidneys and cause them real harm. Now, I know I'm very much aware that there's some debate over that issue, and I'm very much aware I'll get some hater comments or some disagreement where they say, you're wrong, you can take all the D3 that you want. Like I said, I've seen multiple patients that were getting kidney damage from this. I've also reviewed the literature, the science, where it showed patients getting kidney disease and even dying. I've even talked to other doctors who had patients that died from taking too much D3. I know that's a debate. From my perspective, you're not getting more improvements at levels beyond 115, even 100. But you are getting danger and a lot of evidence of real risk. So why take the risk if there's not an improvement, if there's not anything good coming from it? That's why I recommend between 50 and 90, not going over 100. It's true, people with low magnesium do have a higher risk of vitamin D toxicity. Up to 50% of people may be low in magnesium. That's a lot of people. In fact, some of us, myself included, might say that it's really over 50%. So that's something to keep in mind. Magnesium is important. It helps with vitamin D metabolism and supports many functions in the body. Like vitamin D, it's also even important for mental health. But magnesium does not fix hypercalcemia, too much calcium in the blood. It doesn't stop your body from absorbing too much calcium. It doesn't prevent that calcium from building up in your blood. So while magnesium is helpful in general, it's not enough to protect you from vitamin D3 toxicity. This is exactly what Arnold learned the hard way. After a few months on that D3 K2 combo, he still felt fine. But during a routine checkup, his doctor noticed that his calcium levels were climbing and had gotten too high. His kidney function was already starting to drop. Arnold was confused. He wasn't taking any calcium supplements. He was eating better. He was exercising and doing everything right. He was also taking magnesium, thinking that would help. It didn't protect him, though. Magnesium helped in other ways, but it wasn't protecting him from too high a level of vitamin D. It turned out that Arnold was taking over 10,000 international units of vitamin D3 every day. 2 pills with 5,000 international units and a couple of multivitamins that had another 2,000. His K2 dose wasn't nearly enough either. He was getting less than 200 micrograms. So how should you take vitamin D3 and K2? Some people believe you should always take them in a fixed ratio, like a certain amount of K2 for every certain amount of D3. And that's really just wrong. It sounds like a good idea at first because this perceived mechanism that they work hand in hand, and this mechanism, this thought that K2 really does nothing other than manage calcium. Neither of those is true in real life. Your body doesn't need these 2 vitamins in a strict ratio. It needs them for different reasons, and the right amount of each one depends on different factors. Vitamin D3 should be taken based on your blood levels, not a guess, not something that's labeled on a bottle. Some people need more D3 to get their levels where it needs to be. Others need less. That's reality. It depends on things like your weight, your skin color or tone, where you live, how much sun you get, and how well your body absorbs it. All these impact your sun absorption. Vitamin K2 is not something that you just take to match your D3 dose. That's not the point. You take it because it activates important proteins in your body that protect your heart, your blood vessels, and your metabolism. To get those benefits, you need at least 400 micrograms of K2 per day. At least 400 micrograms. And again, don't worry about taking too much K2. Worry about taking too much D3. You might be taking too little K2. That's usually what happens because you're stuck with whatever amount is in the pill. And you're letting your D3 decide how much K2 you're going to take. Or worse, far worse, and to the point of being dangerous, you might be taking too much D3 in order to get enough K2. Ideally, the K2 needs to be in a separate pill. That way you can get the full benefits of both vitamins: strong bones, healthy arteries, better blood sugar control, without the risks of the existing fixed dose combinations. Now, some people don't want to take a vitamin D3 supplement, and that's okay. It's true that your body can make vitamin D3 naturally from sunlight. In fact, under the right conditions, your skin can make up to 20,000 international units of D3 in a single day. But that's not the same as taking 20,000 international units in a pill. When you get D3 from the sun, your body controls how much it makes. If it starts making too much, it slows down the making process. It breaks some of it down. That's why you just don't get vitamin D toxicity from sun exposure. Your body has built-in safety systems and controls. But supplements don't work that way. Once you take a pill, your body has to absorb whatever is in it, at whatever amount, even if it's too much. That's why it's easier to get too much D3 from supplements, especially if you're taking high doses without checking your blood levels. Even though the sun can make a lot of D3, for most people, really, it's just not enough. I hear it all the time, and I'll get hater comments for this too. But go to the content creators that you hear time and time again on social media saying, sun is going to provide all you need. And ask them, find out how many people they're testing for vitamin D levels. Because we test people for that all day, every day. I mean, we have dozens of patients coming in on a regular basis with these numbers. In fact, I can't tell you the number of couples that I've seen. They live in Florida. The husband is out playing golf 18 holes, 4 or 5 times a week. The wife is indoors the whole time. The husband has low vitamin D3 and the wife has high levels of D3, and neither one of them are supplementing, or they're both supplementing the same amount. Why is sunlight often not enough? Well, if you live too far from the equator, the sun isn't strong enough in the winter. And I know that line going from like San Diego or San Francisco down over to the East Coast, that line doesn't work either. I've got plenty of patients south of that line in the U.S. that depend on the sun and just don't get adequate levels. They come in with levels of 15, 20, 25. If you have darker skin, it takes longer to make D3, or at least it takes longer to absorb the sun energy that you need to make the proper D3. If you wear sunscreen or cover your skin, D3 production is blocked. And if you work indoors or don't spend time outside, you miss the chance to make any at all. You can also get small amounts of D3 from food like fatty fish, egg yolks, and liver, but it's usually not enough to fix a deficiency. So while sunlight and food are helpful, they often fall short. They just do. And here's another thing. Vitamin D3 is a fat absorption or fat soluble vitamin. And we see this all the time. And often with that example of the husband and the wife, often the husband's level is pretty low because the husband has more body fat, and that vitamin D3 is being absorbed into his body fat, and the wife has less. As people begin to lose body fat, sometimes their supplement requirements decrease because they seem to be offloading vitamin D3 from the body fat that they're losing. So anyhow, that's why most people still need to supplement to get into the healthy ranges for vitamin D3. I've looked through the science, the literature. From my perspective, I think the safest recommendation is to take a 5,000 international unit pill and measure your level, and then supplement based on that amount. Titrate it to 50 to 90. Let's get back to Arnold. What happened with him? Well, once he's understood what was going on, he stopped taking that combination pill. He got his vitamin D levels tested and continued to test them as he didn't take any supplement at all. He ended up adjusting his D3 dose based on the results and got back to a healthy kidney function and D3 level. He started taking his K2 separately at 400 micrograms per day. A few months later, his calcium levels were back to normal, his kidney function improved, and he felt more confident, knowing his supplements were actually doing what they were supposed to do. Now, before we get into the best natural sources of K2, let me share something important with you. If you're trying to improve your health and avoid heart attacks or strokes, or blindness, or kidney disease, or Alzheimer's, but you feel frustrated with your current care or overwhelmed by all the conflicting advice that you hear online, you're not really alone. I've been through that myself, that same journey. Years ago, I had to dig deep and educate myself just to understand what was happening inside my own body. With the right changes, I was able to reverse my own heart attack risk. Heck, I even reversed my arterial plaque and got rid of all of my soft plaque. Honestly, this can be dangerous without the right support. Did you know that less than 0.5% of doctors actually get specialized training in preventive medicine? And another thing, there are only a couple of dozen doctors in the United States, the entire United States, that are licensed in all 50 states. So that's exactly why I've personally trained a team of clinical advisors who work with me every day, helping people improve their health and avoid heart attacks through lifestyle-first care. If you're ready to take the next step, just give us a call, 859-721-1414, 859-721-1414, or click the link in the description to learn more. We can walk you through your options to help you find something that fits your goals and your situation, not someone else's. And if you're not ready for that, it's okay. I've also created a 7-step heart attack prevention protocol. You can use this, download it for free using the link below, and that will help you have more intelligent conversations with your healthcare provider. It's the perfect place to start because your provider's probably not that well trained in prevention. And this is important stuff. Buyer beware. So make sure that you've taken a look and you know the basics of prevention before you just trust your health to anyone, even your doctor. Now, let's talk about food sources of vitamin K2. Vitamin K2 also comes from food, but just like D3, most people don't get enough from diet alone. There are 2 main ways to get K2 from food: animal products and fermented foods. The MK4 form of K2 is found in small amounts in animal foods like egg yolks, butter, liver, some cheeses, dark chicken meat. The MK7 form of K2 comes mostly from fermented foods. The strongest source is a Japanese food called natto. Natto is made from fermented soybeans. We've had a couple of shows about it. Natto contains more MK7 than any other food. You can also find smaller amounts of K2 in certain aged cheeses, sauerkraut, fermented vegetables, some types of yogurt or kefir, or some people call it kefir. Depending on how they're made, these things can have varying amounts of vitamin K2. The problem is most people just don't eat enough of these foods. Most of these fermented foods are an acquired taste. Even when people do eat enough, the amount of K2 varies so much depending on how the food was made in the first place and where that food came from and whether they had adequate and appropriate fermentation processes. So, as you can see, vitamin D3 and K2 play a big role in supporting artery health and helping reverse plaque, but they're not the most important part. If you want to know how I reversed my own arterial plaque, D3 and K2 helped a little bit, but there was a lot more to it. A lot more. Check out this video right here.